My name is Lisette Martinez. I'm the EVP and Chief Diversity Officer for Jefferson Health and Thomas Jefferson University. I started my career in supply chain, and I had an opportunity come across my desk for a diversity manager position. And when I saw the word inclusion, I thought back to my 12-year-old self. I remember a camping trip in the 6th grade. I remember coming out of the lunchroom with my tray and looking into the room thinking, where do I sit? So the counselor's looking at me and saying, Lisa, what are you doing? And I said, well, where do I sit? She goes, you can sit anywhere. And I said, but my black friends are on one side and my white friends are on the other. Where do I sit? She turned around and without question made everyone move. And it was at that moment that I felt that word of inclusion. It felt like I belonged, like I was valued. Everyone knows what being excluded feels like. And that's why it's so incredibly important for organizations to make sure that we have inclusion programs so that we really can add value and engagement to an organization. The amount of care that the clinical teams have in really wanting to connect with patients was something I had not seen. And it was something that really helped me learn that they really wanted to understand culturally how to connect better with people who were different from them. It's a way to help folks get better faster and adhere to treatment. I started my career here in May. 3 weeks later, the murder of Mr. George Floyd occurred, and we started providing for our employees a space for healing called Brave Conversations. Brave Conversations stand for bold, relevant, authentic, valuable, and educational conversations. It's a space in which people can come together and talk about diversity, inclusion, current events, have a space where people can really get off their chest what they're feeling. We conducted them every single day. We spoke to over 1,000 people in a month. And we were there to listen. It was a traumatic time. It was very painful, but it really helped shape how we were going to build a blueprint and how we prioritize diversity, equity, and inclusion for this institution. The blueprint was created from really listening to our employees, where we were able to gather the data and segment it into 5 different dimensions and create a blueprint for this organization that was the first one in over 196 years. From what employees asked for, a huge one was accountability and access into this organization, and how do we increase access? And we created a goal to make that happen. I would love folks to say that they love Jefferson. This is the place that they want to go to because they trust Jefferson. Although I've only been here for a year, I'm incredibly proud of the infrastructure that leadership has built, the commitment and engagement that they have at this level. It's incredibly important. You don't see this very often, and you have leadership here that truly is committed to this work and wants to see movement in a big way. And I'm really proud to be part of this enterprise.